Hi everyone, today we're going to be presenting on postpartum depression. This is an extensive guide for expecting mothers, partners, and their support systems. So what is postpartum depression? Postpartum depression, also known as PPD, is a major depressive episode experienced by 15 to 20% of women. Depressive symptoms severely affect women's ability to adapt to everyday life and motherhood after pregnancy. PPD can strain relationships with loved ones, including children, spouses, family, and other support networks. 1 in 10 women experience PPD every year in the US. So, how do we diagnose PPD? The DSM-5 considers PPD when a patient has a major depressive episode along with peripartum onset. However, it is not mentioned as a separate disease. So, the symptoms include depressed mood most of the day, anhedonia or loss of interest, difficulty sleeping, loss of energy or fatigue, thoughts of harming yourself or the baby, and difficulty concentrating.
Some risk factors associated with postpartum depression include psychological, which also include history of depression and anxiety or negative feelings towards the baby, a family history of mental illness such as schizophrenia or bipolar disorder. Some obstetric risk factors include risky pregnancy, such as emergency C-section or hospitalizations, PMS or premenstrual syndrome. Conditions associated with PPD include meconium passage, umbilical cord prolapse, preterm or low birth infant, and low hemoglobin. Some social risk factors include lack of social support, a history of sexual abuse. Some lifestyle risk factors include decreased sleep, which can perpetuate extreme fatigue and mania. Stressful life events during pregnancy can also put you vulnerable for postpartum depression. So the connection between postpartum depression and memory, studies have showed that those who experience depression, including those with PPD, tend to remember fewer details about their personal experiences, i.e. having lower episodic specificity. When individuals were trained to increase the degree of episodic specificity in their autobiographical memories, a decrease in the rate of depression was also observed. So overall, difficulty encoding, consolidating, and retrieving memories were found with patients with postpartum depression.
PPD also often leads to difficulties in concentration and decision-making. So the first point is cognitive impairment. There is a cognitive fog, which can make it hard to process new information or recall previously learned material. There's also emotional distress. So the emotional turmoil associated with PPD, like persistent sadness, anxiety, or irritability, can be distracting and make it difficult to focus on learning tasks or remembering information. Sleep disturbances. PPD frequently disrupts sleep patterns. Poor sleep can impair cognitive functions, which includes memory consolidation and the ability to learn new things. There's also a stress response, since PPD is often accompanied by increased stress. Chronic stress can impair brain functions related to memory and learning. Lastly, there's an impact on brain regions and hormones, the main ones being serotonin, dopamine, norepinephrine, and hormonal fluctuations. Stress and emotional distress can contribute to hippocampal changes, and depression has been associated with changes in the activity and structure of the prefrontal cortex. The neurobiology behind PPD, serotonin, dopamine, and norepinephrine play a big role. If there are imbalances in serotonin, low levels of serotonin are commonly associated with depression, and this imbalance can also affect cognitive functions, including memory and learning. Dopamine is crucial for motivation, reward, and attention, and norepinephrine is involved in alertness and concentration, and the imbalances can contribute to difficulties in focusing and processing new information, which is common in PPD. There are also some hormonal fluctuations, specifically shifts in estrogen and progesterone. These hormones have receptors in the brain and can influence neurotransmitter systems. Fluctuations in these hormones can affect mood and cognitive functions. And cortisol, the stress hormone, is often elevated in depression, and high cortisol levels can have neurotoxic effects, particularly on the hippocampus, which is vital for memory formation and recall. Lastly, the brain-derived neurotrophic factor, or BDNF, is crucial for neuroplasticity, which is the brain's ability to form new connections and pathways. It's important for learning and adapting to new experiences. Depression is often associated with reduced levels of BDNF, which could impair learning and memory. So why is it important to be aware of PPD? Acknowledging the importance of the fourth trimester can also help emphasize the necessity of postpartum follow-up visits, which play a critical role in the mother's overall well-being. Only 40% of mothers attend their postpartum follow-up visit when it is a necessary time for mothers to get support. As many as half of PPD in new mothers go undiagnosed because of stigma, privacy issues, and fear of disclosure.
So how do we treat PPD? Treatment and support for PPD symptoms usually begin during the fourth trimester OBGYN care. Treatment plans differ depending on severity and patient history, but may include a blend of antidepressants, therapy, group counseling, and family therapy. If experiencing suicidal or homicidal ideation, contact the 988 Suicide and Crisis Lifeline or a medical provider immediately. So here's our works cited, and everyone can get started on the discussion questions.